Where are you going to put this cash to work?
Yeah, absolutely. So, with this capital, we are primarily going to invest in three critical areas. One, expand into new markets, as well as grow our current markets, which include the US, as well as enter new potential markets, including Japan and China. The second would be build up our operational and commercial infrastructure to scale. And finally, we would use the investment primarily to advance our product pipeline to get into new therapeutic areas.
So interestingly, you weren't actually planning, at least yet, to do the Series C, right? But SoftBank actually got in touch with you after the outbreak of COVID-19. So is this just the kind of sense that existing trends have been accelerated in healthcare going digital by the pandemic?
Yeah, that's a great question. Certainly we have made great progress in the past 1 year since we closed our Series B in May 2019. But the pandemic really fast-forwarded the market. The need for virtual monitoring of patients remotely at home, keeping them away from hospital. And we were quickly able to even customize our platform to monitor patients with COVID-19, rolled it out in 5 different countries, but also monitoring non-COVID patients. And certainly, we reached out and were contacted by SoftBank, and they have been following us for quite some time. And certainly, in May and June, when we met up with them, there opened up multiple opportunities to enter new markets where SoftBank has access to, including Japan and China, but also accelerate our organic growth. And that's when we decided to raise Series C.
Kuldeep, let's get deeper into this potential expansion when it comes to markets. As you pointed out, your patient base is in the US, China, and Japan. Where else are you seeing potential to grow, given your capabilities when it comes to digital and that AI focus?
Yeah, absolutely. US and Southeast Asia have been our focus currently, but Japan and China would be the key markets we would, enter. But the most important thing, what I want to highlight is for the next, at least the next 12 months, we would be super laser focused on, growing the US market and Southeast Asia, where we already have presence, and gradually preparing for new markets, since these new markets require new regulatory clearances of our solution, because we build digital therapies which have to go through clinical validation, regulatory approvals before we can get into these markets.
What's it been like engaging with traditional hospital operators, given the push towards more digitization and online healthcare solutions?
Yeah, that's a great question. And since the pandemic, especially in the US, many hospitals have mandated the use of telehealth in managing patients with cardiovascular conditions, patients living with cancer, et cetera. But I think the shift, what we saw in the past few months, was just a video call wasn't really enough for clinicians to make a clinical decision, because clinicians are used to providing care. And that's where, really being able to use, a platform, we can capture passive data, active data, use AI to be able to predict decompensation, but provide actionable insights to the clinicians to intervene was critical. And that's when combining, a digital platform with telemedicine was a great blend. And there has been a significant change in the hospital systems who are starting to embrace the technology. There's change in the regulatory environment where, regulators, payers are becoming more, active and embracing digital technologies.